Autism is a condition with a significant burden, and it is important that this condition is recognized early in order to minimize its impact. Therefore, it is important to develop services equipped for early diagnosis and treatment. Early childhood is a time of rapid brain growth. However, certain genetic and environmental factors may cause a delay in the development of the brain. These may cause communication difficulties, social and behavioral challenges which may manifest in a spectrum of disorders known as autism. According to the World Health Organization, by the year 2020, childhood neuropsychiatric disorders will rise by over 50% internationally. A study in the United States of America revealed that 1 in 68 children is affected by autism. In Sri Lanka, according to a study conducted in suburban Colombo, 1 in 93 children is born with autism. Therefore, it is important to recognize its occurrence in our children. Currently, there is no specific medical test or diagnostic method to identify autism. Hence, the diagnosis is based purely on clinical observations and evaluations involving a multidisciplinary team, including a child psychiatrist, pediatrician, neurologist, psychologist, speech and language therapist, and an occupational therapist. From birth, differences in a child's communication, social interaction, and behavior may be delayed or different and could be the primary observations in the identification of autism. This is usually first noticed by the parents. A normally developing child acquires varied responses to external stimuli, such as smiling, speech, and facial expressions. Early identification of autism requires attention to the lack of these developments. Normally, these developmental changes can be observed by 1 to 1.5 years. In most cases, symptoms may appear during childhood. Nevertheless, some of them, such as a difference in social interactions, may manifest later in their childhood. At whatever stage this condition presents, the child's communication, mental, social, and behavioral development needs to be assessed using a scientific and standardized method in order to provide adequate support for this condition. The treatment of a child with autism requires great responsibility and care, and continuous and close supervision from a dedicated team of professionals. Not only the medical team, but the involvement of the parents, family, teachers, different institutions, and societal awareness and cooperation is needed to help children with this condition. The prevention of the condition of autism through public awareness is important. In the early stages of the condition, detection and necessary treatment gives rise to good results. In these children, communication skills, social interaction, play skills, physical activities, social skills, and speech and language skills play an important role. Furthermore, daily and regular interaction of these children with other children in educational and other activities results in better outcomes. Currently, the Lady Ridgeway Hospital for Children has a special unit for the treatment of children with autism, providing parental awareness and education during the treatment period, with an activity plan and home-based activities. It is the government's objective to expand this service and make it available to all affected children in the country, even those residing in distant villages. In this regard, the specialized care teams and treatment units have to be established with the necessary facilities and funding. Therefore, allocations need to be made in the areas concerned. Specially trained multidisciplinary teams have to be mobilized throughout the island so that parents of children with autism can be taught and trained in order to improve parent-centered treatment methods. This is expected to minimize the attraction of patients to places without such standard care, or where ad hoc activities take place with varying interest of treating autism. The provision of a better quality service, focusing on specialized attention to treat autism, would ultimately lead to better outcomes.